All right, now to the latest in the fight against COVID-19. As vaccine supply exceeds demand, Texas health officials are changing the way they get shots to providers. Starting next week, pharmacies, doctors' offices, and other providers will order the amount of vaccine they say they need. Doses will no longer be sent automatically by the state. Health officials say shipping directly to providers is going to go a long way to make sure shots are available when Texans want them. Major announcement from Pfizer today. The company now seeking full FDA approval for its vaccine, not just emergency use authorization. A move that could offer confidence to lots of people still sort of on the fence about getting vaccinated. ABC's Kaylee Hartung has more.
This morning, Pfizer announcing they're starting the submission process for full approval for their COVID-19 vaccine in the U.S. This as California counts down to mid-June. That's when some specialists at UCSF say the state could reach herd immunity.
It's big, it's important, here's why. Obviously, on some level, day-to-day vaccinations will continue, and in that way, it's not a huge deal. But it's a signal that we have so much safety data now on millions and tens of millions of people that we can get the full authorization, the full approval.
Anywhere that had terrible surges paid a price to get there. We never wanted to get to herd immunity with a combination of natural infection and vaccination, but that's what California went through.
This timeline in line with the state's plan to fully reopen on June 15th after a promising turnaround. Dr. Therese Hammond runs the ICU at Providence St. John's in Santa Monica. When we spoke to her in December, hospitals across Southern California were overwhelmed.
Right now, my ICU looks like an absolute war zone.
Here we are talking 5 months later.
We're starting to see a little bit of the emergence of the spring and summer that we hope to see. We unfortunately had someone die yesterday of COVID, so it's still there.
As the pandemic's death toll keeps climbing, the CDC predicts the U.S. could surpass 600,000 deaths by Memorial Day. Now all eyes are on vaccines. The question is if and when they'll be authorized for children. Moderna announcing its vaccine is 96% effective in 12 to 17-year-olds.
The goal would be to make sure that the vaccine is available for vaccinating adolescents over the course of the summer and at least before the coming school year.
But not all parents are jumping to sign their kids up right away. One poll finding just 3 in 10 parents are planning to get their 12 to 15-year-olds vaccinated immediately. 25% say they will wait and see how the vaccine's working. And nearly a quarter say they will not vaccinate their child.
And next Wednesday, assuming FDA authorization, the CDC advisory panel is expected to greenlight the Pfizer vaccine for kids 12 to 15. And at that hearing, they will also have an update on those rare blood clotting cases seen after the Johnson & Johnson vaccine. Kaylee Hartung, ABC News, Loma Linda, California.